In this video, part 2 of our high-risk medicine series, we're looking at serious adverse effects. So what exactly do we mean when we say a medicine can cause a serious side effect? In simple terms, some medicines can trigger reactions that are strong, harmful, or unpredictable, even when they're taken correctly. That's why they're called high-risk medicines. So let's jump straight in with what doctors usually describe as two kinds of reactions, type A and type B. Type A reactions are predictable. They're basically an exaggeration of what the medicine is meant to do. For example, blood thinners, which help prevent blood clots, can cause bleeding if the effect goes too far. And insulin, which lowers blood sugar, can cause dangerously low sugar if you take too much or skip a meal. So these reactions are serious but often preventable with good monitoring and dose adjustments. Then there are type B reactions, the bizarre ones. These are not predictable and don't depend on the dose. For example, a severe allergic reaction from antibiotics like penicillin, or a rash, swelling, or breathing difficulty that happens suddenly even if you've taken the medicine before. These are much rarer, but when they happen, they can be life-threatening and they require emergency care. So let's look at a few examples of medicines known for serious side effects and how doctors help reduce the risks. There's opioid painkillers like morphine or oxycodone can slow down breathing, especially when someone first starts taking them or when the dose increases too quickly. That's why doctors start with a low dose and increase slowly. Then there's blood thinners like warfarin or newer drugs called DOACs, such as apixaban, that can cause bleeding. So your doctor checks things like your age, kidney and liver function, full blood count, and other medicines you're taking before deciding the right dose. And immune system medicines like azathioprine or methotrexate, which can sometimes reduce the bone marrow's ability to make blood cells. And fluoroquinolone antibiotics such as ciprofloxacin, these carry a specific FDA and MHRA warnings that they can cause tendon rupture, so patients are warned to stop taking at the first sign of tendon pain. So how do doctors and pharmacists keep you safe? Well, before starting one of these medicines, your healthcare team usually checks your blood work and organ function, starts with the lowest effective dose, and schedules regular monitoring, especially in the first few months. If something starts to go wrong, they can catch it early and make changes before it becomes serious. And what can you do as a patient? You also play a big part in staying safe, and here's how. Take your medicine exactly as prescribed, keep your checkup appointments and blood tests, and tell your doctor or pharmacist if you start any new medicines, even herbal or over-the-counter ones. And watch for warning signs like unusual bruising, tiredness, breathlessness, or allergic reactions. And if something feels off, don't wait. Call your doctor or seek medical help. So this is part 2 of our series on high-risk medicines. If you missed part 1, I will leave a link below where we explained medicines with a narrow safety range. And in part 3, we're looking at another important group, medicines that need regular blood tests or monitoring to keep you safe. Thank you for watching, stay informed, and always take your medicines safely.